The Public Health Emergency Act passed in Parliament to allow this government or any other government to use in the case of a health crisis. So what's in the Act? The Public Health Emergency Act consists of what legislative powers the controller in the emergency has. Firstly, all rights under the Constitution of qualified rights, which include freedom of movement, freedom of expression, freedom of gathering, and freedom to information, are restricted. The Act provides for the setup of a National Control Centre for a coordinated national response. That centre will consist of Technical Advisory Council that consists of head of government bodies.
I think that law is just absolutely too powerful and infringes on everybody else's right. Let me categorically ask our people that this is not so. It is not overwhelmingly powerful. It is not superior than our constitution. It is within the ambit of constitution. Whilst rights, if needed, will be diffused or contained within the provisions of this law. These are all qualified provisions. For instance, if need be to apply this law when there is a medical emergency, only on medical emergencies based on medical recommendations by our doctors and our health department, then the health minister will bring these recommendations into NEC. NEC will then look at the merits of the case, then advise the Governor General that this area of our country, this spot in our country must now come under this sort of control mechanism so that we keep our lead on possibility of the pandemic from spreading throughout the country or elsewhere.
The controller will be given full powers to carry out the national emergency while also carrying out directions from the National Executive Council. The Act allows for the controller to have full financial control and procurement powers, as the Public Finance Management Act will not apply when an emergency is declared. The opposition finding issues with this.
Really, it was not really proper that only the controller should have the power to carry out the procurement of goods, works and services. And the fact also that we never went through this legislation.
The Act states that no later than 3 months of furnished acquittal of funds must be given to the Health Minister and NEC. The Act only will be invoked when a health emergency occurs. As for the COVID-19, the state of emergency is expected to come to an end this week, and most of the surveillance and testing for COVID-19 response will still be continued by the National Department of Health. Adelaide Sirks, Kari National, EMTV News.